Hi, I'm Brad Byrne, a Senior Risk Management Consultant at ProAssurance. Informed consent is a fundamental ethical and legal requirement in healthcare, but there are several common misconceptions about what it entails. Misconception number 1, a signature equals consent. Sometimes, the informed consent process is viewed primarily as a legal requirement to protect healthcare providers, rather than as an ethical obligation to ensure patient understanding and autonomy. This can lead to a focus on obtaining a signature rather than on genuine communication and understanding. Obtaining a signature on a consent form does not constitute informed consent. A signature is only a formal acknowledgement of consent. True informed consent requires that the patient fully understands the procedure, risks, benefits, alternatives, and potential consequences. It's a process of communication, not just a formality. Misconception number 2, it's a one-time event. Informed consent is not a one-time event. It is an ongoing process. Consent should be a continuous dialogue between the healthcare provider and the patient, especially if there are changes in the treatment plan, new information becomes available, or there are changes in the patient's condition. A patient's ability to provide informed consent might change over time due to illness, injury, or other factors. Continuous assessment of the patient's understanding and voluntary agreement is necessary to ensure that consent remains valid. Misconception number 3, consent is only necessary for surgery or major procedures. Informed consent should be obtained for any medical procedure or treatment, including diagnostic tests that pose risks or has alternatives. Misconception number 4, lack of objection equals consent. Silence or a lack of objection from a patient does not constitute informed consent. Consent must be explicitly given, and the healthcare provider must ensure that the patient fully understands what they are consenting to. Misconception number 5, family members can always provide consent for incapacitated adults. While family members often provide consent for incapacitated adults, the legal authority to do so may vary based on jurisdiction, relationship, and the presence of legal documents like power of attorney. Misconception number 6, consent is not required in an emergency. While there are exceptions for informed consent in emergency situations where immediate action is required to save a life or prevent serious harm, these are specific circumstances. The general principles of informed consent still apply whenever possible. Understanding these misconceptions and recognizing that informed consent is a complex, ongoing communication process is essential for healthcare providers. It helps to promote patient autonomy, improve treatment outcomes, and reduce legal risks.